Hi, this is Shelley Kraft, and welcome to SNNLive. We're at the Biotech Showcase 2012, and I have Karen Zaderej of AxoGen, AXGN. Welcome to SNNLive.
Thank you, Shelley, for having me on. I appreciate it.
It's good to have you. I want to hear the AxoGen story.
Well, AxoGen is a regenerative medicine company focused in peripheral nerve. We help surgeons repair transected or injured peripheral nerves so that patients can go back to where they were before in terms of function.
How do you do that?
We have 3 products that are available. There's the advanced nerve graft, and it is a surgical product that the surgeon can repair a nerve and allow either the muscles, some motor function, or sensory function to be restored back to, again, our goal is back to where they were before without pain.
You know, this is an amazing area, this regenerative medicine. I mean, if you're the hot topic.
Yes.
I mean, really, So I'm sure you had a full room when you went in and did your presentation. What's going on that makes it so interesting?
Well, I think what's really new is that traditionally the only way that a surgeon could have to do this repair is to take a nerve from somewhere else in the patient's body and transplant it. So for the patient, that meant that you were always going to lose something. You had to give up some function to get the use of your hand back, let's say. And so, that's not a great solution, but it's the best there was. By coming up with this regenerative medicine solution, we give the surgeon such a great new option to give patients back their function. And that's what really makes it exciting, is it opens up a whole new area of healthcare with introducing new technology.
What is the technology that you use?
Really very interesting. Our again, base product, the advanced nerve graft, is actually originally human tissue. It's human allograft nerve, and it's through the tissue donation process. We decellularize it, so we remove all the cells and cellular debris, but preserve a very essential microarchitecture called the extracellular matrix. And what happens, and it's a very elegant, simple solution, is that the body recognizes it as a nerve and repopulates it with cells and essentially grows back the patient's own nerve.
What's your background?
I'm an engineer undergraduate, MBA from Kellogg, and I've worked for healthcare and surgical products for 20-some years. I worked for Johnson & Johnson, Ethicon for many of those years, and just love advancing healthcare.
You look like someone who loves going to work every day.
I do. AxoGen has been a great company to join. It's a growing company, a lot of enthusiasm, and at the end of the day, like I said, what motivates us is those patients that have an impact to their life.
And this is currently being put into patients, and wow.
Yeah, we are commercially available in the United States today. We're starting to expand around the world. We're used by the military for wounded warriors to restore function when they have those IED explosions, and trying to work with them to help prevent amputations. That's a big goal that we all have.
That's wonderful, wonderful, wonderful. Let's get that website, please.
Well, there are 2 places you can go. Our company website is www.axogeninc.com, and there's also an educational website called aboutnerve.com if a patient would like to know a little bit more about nerve injuries and how they can be repaired.
And Karen takes phone calls. Do you have an 800 number? Really?
They can call on the website. There's contact information, either email or phone numbers. And yes, happy to take phone calls, answer questions, and work with this.
It's widely available throughout the United States. You don't have to go to a particular surgeon or a special hospital. It's around.
Yes, widely available, easy to access. If they need a surgeon in their area, we can also refer surgeons for treatment.
Ladies and gentlemen, AxoGen, AXOGEN. It's a public company, and this symbol is AXGN. Karen Zaderej, I want to thank you for coming on.
Thank you.
You did a
Appreciate
great
the time.
job, and what an interesting little company.
Great. Thank you.
Thank you.